Well, good day, everyone. My name is Larry Gostin. I'm the founding O'Neill Professor of Global Health Law and Director of the O'Neill Institute for National and Global Health Law, and affiliated with the WHO as well. I wanted to welcome you all on behalf of Professor Jeff Crowley and myself to the kickoff of the O'Neill Institute's Colloquium on National and Global Health Law at Georgetown University Law Center. For the students who are just joining for class number one, Jeff and I will be talking with you and getting you situated to the class in the second hour. But I also want to welcome our wider audience. We've got a robust audience from around the United States and other parts of the world to our open session of the O'Neill Colloquium, where we're going to be discussing the COVID pandemic, and particularly hearing from three of the world's leading experts about where do they see us now with COVID-19, what lessons have we learned, and where are we going in the immediate, medium, and longer term future? What are the paths ahead of us, and how can we change our destiny to be more effective, more humane, and more just going forward? And so this is our plan. I'll first introduce our three speakers. Then each of them will talk around 5 minutes. I'll then moderate a conversation among us all, just really interactive, hopefully dynamic, so we can all be flies on the wall and just kind of listen to their reflections about the pandemic. And then we'll ask for questions from our students, and I've already got a lot of questions from our registrants in advance, but if you've got more, please send them in. So as I say, the three people that are going to be on the panel today are three of the people I admire most in the world. That's why Jeff and I invited them. The first is Devi Sridhar. I've known Devi for many, many years at Oxford and elsewhere. She's the professor at the University of Edinburgh, a wonderful place, personal chair in global health at the university, and the founding director of the Global Health Governance program there. She was at Oxford University before that. She's written a couple of books. Her latest one is a fantastic book called Governing Global Health with Oxford University Press. Salim Abdool Karim is a clinical infectious disease epidemiologist. Everyone from the global HIV/AIDS world knows him and admires his vast leadership in that area. He's the Caprissa Professor for Global Health at the Mailman School of Public Health at Columbia University, and the Director of the Center for AIDS Program Research in South Africa, a giant in our field. And our cleanup hitter will be Ashish. Many of you will know him from his public appearances in the United States. Ashish and I go back a long way. We were served together on a global West African Ebola Commission report that included the National Academy of Medicine. He just left, I think just today or yesterday, as the professor and director of the Harvard Global Health Institute. He's now the dean of Brown University's School of Public Health, somebody that people in America look to constantly for his wisdom about the pandemic. So I'll call on each of you in that order. Why don't you kick us off, Devi? And thanks so much to all of you for joining us. I really appreciate it.
Thank you, Larry. And I'm actually really delighted to be here. I spoke to the O'Neill Fellows in the class, I think it must have been several years ago, actually, in DC at the law school, and that was terrific. And I guess in today's world, this is the closest we get to it. So thank you for having me. I don't know if it's possible to share my slides, Kyle. I just have 3. If not, I can just speak more broadly. Oh, here we go. Okay, so actually 4 slides. So I just wanted to make several points about where we are with the pandemic. And the first is that it's still taking off. I think there's sometimes this view, especially in Europe, that the pandemic is over and that we can all move on with our lives. And what this graph shows is that every day new daily records are being set in terms of the number of cases. And you know, the worst might be ahead of us. It's not necessarily behind us. And I think that's quite shocking to some people who think we've already been through a lot of whatever is 6 months, 8 months, 9 months of this. We move to the next slide. What I wanted to show here with this slide is actually how the pandemic has shifted from China, which was first hit in January, but has really gained hold of it. They've now had many days with no local transmission. And then you can see it moved into Asia, here South Korea and neighboring countries, Hong Kong, Singapore, then started taking off across Europe. You saw Spain, Italy being heavily hit, then France, Britain, North America coming in there, Canada, the United States, Mexico, and now we're seeing a big hit in South America as well as Asia, and that's because of India on the bottom and some of the large populous countries in South Asia. So where the epicenter of this pandemic has been has changed over time, and actually the way it's played out, but it's almost been like a time machine in that, you know, some of the debates that we were having in March in, let's say, Britain were very similar to the ones that were happening in East Asia in January, February. You could kind of see it evolving, and now I see some of the debates across in the United States, and those are the ones Europe had a few minutes ago. So you only had to look at different parts of the world to you could see where you would be heading in a couple more months. And I think Africa now, you can see it hasn't been as heavily hit. And that's, I think, you know, remains to be seen how that will play out in the next couple of months. Again, this is confirmed cases, and of course it's lower than total cases because of limited testing in different parts. We move to the next slide. Part of the difficulty for governments in deciding how exactly to deal with this pandemic is because of uncertainty, and scientific advisors are having to advise under considerable uncertainty over the evidence base. So I just wanted to kind of lay out, I won't go through all of this in detail. If you have questions about it, I'm happy to come back to it. Some of the things of what we know and what we don't know, from immunity, in terms of we still don't know how long immunity lasts, the extent of population immunity. That's one that I think is heavily debated, especially the role of T cells, given we know that antibody prevalence seems quite low compared to what we would expect. The health issues, we focused a lot at the start at deaths and the case fatality rate, where actually now there's a focus on disability. This is a multi-system disease. We have long haulers, but actually we don't really know how long recovery could take, the exact percentage of people, and why we're seeing this and how to treat it. A vaccine, we have several promising candidates. We don't actually know whether one will provide protection from reinfection for how long. Treatment, we have 2 approved treatments. We still don't have the really crucial treatments of keeping people outside of hospital. And finally, in children, which is a real puzzle, we understand they can carry the virus, but actually why children seem less affected, and the particular role of schools, which I know is being heavily debated in the United States. In Scotland, we've had schools open for 3 weeks now, how exactly they will play into community transmission. Go to my final slide. Future scenarios for countries all have trade-offs. There's no optimal way. It's only the least worst way you're going to take, and what are you going to trade off? So if I could kind of characterize broadly the 3 models of how to deal with COVID-19 by different governments, the first would be what we can call the New Zealand or the island model, what Bali has done, and Fiji and Iceland and the Faroe Islands and New Zealand, which is just eliminate it, lock down hard, clear the virus, put in strict border measures, and try to keep stopping imported cases as best you can. Then you have the control model, I think perfected best by South Korea or Germany, which is you have a voluntary or kind of light lockdown. You have a very strong test, trace, isolate system. You have strict rules over your super spreading events and light border checks. And you just try to keep things operating, but you try to kind of simmer the virus rather than just get rid of it and keep as much as you can going. I think Britain is now following into this as well. And then you can call, I know it's being debated in the States now, the herd immunity, or one people have often referred to it as a Swedish model, which is you kind of run the virus slowly through. You hope that it mutates into a milder version or there's treatments available. You keep your death and disability to a minimum. You try to ensure your health services don't collapse in the meantime. And you try to keep confidence in the economy so you don't take the economic hit. And so I think actually, funny enough, Sweden is going to move more and more to the control model in the middle, and you might see movement between these. So these are kind of like, I guess, sketches, and probably countries fall in between these and try different strategies. And just to say, no country knows the ideal way through, and all of these have trade-offs over what it's actually going to give. So I'll stop there and happy to take any questions and have a discussion. Thank you.
Okay, thanks, Devi. Slim, did you want to jump in with your remarks now?
Yes, sure. Thanks very much. Can you hear me?
I can, yes. Thanks very much, Slim.
Okay. Thank you. So I thought I would just take 5 minutes to give you a sense of, just 4 thoughts about where we're heading to and what lies ahead. So just by way of background, from my local experience, this is where South Africa is in the COVID-19 epidemic. We've been through the surge, we've seen the rise in admissions, the rise in deaths, and we are now at the tail end of the decline post the surge. So the question is, are we over the worst? Well, the answer is actually a bit complicated. And the one thing that's becoming clearer is country after country, we are seeing a second surge. And this is despite the effective use of the COVID-19 prevention toolbox and all of the tools, social distancing, hand washing, and so on. And so the basic strategy has been, well, we'll just try and keep some kind of control until the vaccine becomes available. Hopefully it'll be an effective enough vaccine, probably going to be partially effective. But we are seeing in Belgium, here's a second surge. In Australia, the second surge in Melbourne was even worse than the first. And even New Zealand, that announced 2 Mondays ago that they've had 100 days of no local transmission with the effective elimination. 2 days later, Auckland was in lockdown with 17 new cases, and they've now exceeded 50 new cases. So it just shows you that there is literally no room for complacency. So the first point I want to make is that we have to expect that we will live with multiple waves and surges, and we're going to live with this virus for quite a long time and deal with its challenges despite using the prevention toolbox. The second contradiction I think we're going to see play itself out in a very substantial way next year is that we're going to see this huge contradiction between the livelihoods that the economy is meant to protect and provide versus wealth. So on the one side, you see the World Bank talking about the worst recession, unemployment is rising. On the other hand, Apple stocks have now topped $2 trillion. It took Apple 38 years to reach the first trillion and 2 years to double that. Tesla, as you might have seen, Elon Musk is now the 3rd richest person in the world. Tesla and Apple have had a great run, but here's why they are poised to rocket even higher next year, came this article. So I think we're going to see 2021, where the divide between the haves and the have-nots will become a deep canyon. And I think it's going to become one that's going to be really not acceptable and not tolerable. And then we're going to see a real challenge to this contradiction between livelihoods and wealth. The third contradiction I think we're going to have to grapple with is this digital divide. And I've been, seeing this firsthand, how the digital divide is creating a whole new disadvantaged class. That those, even though we're seeing digital access is being scaled up, and the UN has a huge program on this, and we know that around the world, about 60% of people have access. But in sub-Saharan Africa, and I serve on the task force for the coronavirus in Africa, and we've been grappling with this problem that without having access to a computer or to the internet, the real challenges of working from home or continuing schooling from home. So I think 2021 is going to be the year where we're going to have to find some effective way to bridge the digital divide. And then finally, I think we're going to see some real changes in how we are preparing for the next pandemic. So even while we live with this one, we're going to have to deal with the fact that there's probably a bat coronavirus that's already a new one that's already infected humans. And if you go with Peter Daszak's analysis, that's happening all the time, that we're going to have to figure out a way to deal with overturning the inequities where people can't be dying just because they can't afford healthcare. And so the whole push towards universal healthcare, I think we're going to see a lot of that. And I think we're going to see this COVID-19 as a warning bell for even worse future pandemics, and to adopt the One Health approach between animal health, because so many of these infections are zoonoses. And finally, that it's going to have to lead to some kind of strengthening of the public health surveillance, because the public health response is going to depend on preventing small outbreaks so that we don't get major pandemics, the so-called, fighting the flames to prevent the fires. Because if we don't effectively fight the flames, find the flames and fight them, we will be dealing with major fires. Thanks very much, Larry.
Thank you, Salim. Appreciate it very much. And Ashish, over to you now.
Great. So thank you, Larry. And I don't have slides, so I'm just going to speak for about 4 or 5 minutes and truly try to build on both what you heard from Devi and from Salim about where we are as a world, and then where we are as a country, and where I think we are going next, certainly as a nation. So as Devi mentioned, we are, as a global community, we're very much still in the throes of this. And I have been arguing that we have more days ahead of us than we do behind us. So we may feel like we are done with this pandemic, but as the old saying goes, the pandemic is not done with us. We have a long ways to go. And it depends, of course, on how you want to mark both the beginning and the end of this pandemic. If we mark it around January as the beginning, January of this year, it is unrealistic to think that we will have the pandemic under good control and largely behind us anytime before the summer to fall of next year. Even if everything goes incredibly well, even if we get a vaccine this fall, that looks like it's safe and effective, the ability to ramp up to billions of doses to actually get that out across the world, I think we have consistently underestimated the difficulty of that endeavor. So, first point here is this is at the best case scenario an 18 to 24 month pandemic, and we're about 8 months into it. So many more days ahead of us. Second point, and I want to focus a little bit on the United States, is if you look at the US, first and foremost, you could just begin with the argument that the US response has been a disaster. And by many measures, it has been. But I'm actually going to ask you to think about the US as two different places. So first, there's no doubt there's a bunch of national stuff, the blindness of the disease in February and March, the national lockdown of March, April, and May, that was not complete, that wasn't thorough, where large parts of the country remained open. But what has happened since then is a divergence, and what I essentially argue are two separate patterns within the United States. There is what I would argue is the European model, and then what is the Brazil model. So if you look at the northeastern United States and parts of the Midwest, so much of New England, New York, Pennsylvania, even Maryland, Michigan, Ohio, and just put all of those and think of them as a country. They probably represent about 100 million people. And if you plot out their curve, it looks exactly like Western Europe, right? Big hit up front, pretty serious lockdown, and now relative control of the disease. New York State, with 20 some odd million people, has been testing 80, 85,000 people a day and returning less than 1% of those people as positive. Massachusetts is at 2% positive. Michigan's at about 2.5%. These are states that have it reasonably under good control. So that's almost arguably the Western European model. And I understand Western Europe is not a country and there's a lot of variation between Sweden and Denmark and Germany and the UK and France. But if you think of it as a block of nations, parts of America really look like that. Parts of America look a lot like Brazil in that they never really locked down. They kind of pulled back some, and then around Memorial Day, they opened up far too aggressively. And what we saw through much of June and July is out of control wildfires, generating thousands and thousands of cases a day. For about 3 weeks, Florida was generating more cases than the entire continent of Europe. So not just the European Union, but also Russia thrown in. Florida was outdoing the entire continent of Europe. What has happened over the last month has been clear pulling back as the number of cases and number of deaths just became, I think, unmanageable, and people could no longer just ignore it and live with it. But when I look out over the fall and winter, I expect a set of states to continue to be able to manage the disease under reasonably good circumstances, and a set of states that are going to continue to go back and forth between pulling back until the disease is sort of tolerable, then relaxing things, letting things get out of control, and this back and forth that we're going to see across much of the South, parts of the West, parts of the middle of the country. And that really does pose substantial challenges. One last thing about this is a uniquely American model because of our federated approach. Federalism has some upsides, I suppose, if you're in one of those states that has it under reasonably good control. But even there, you feel the lack of federal leadership, and the lack of federal coordination, the lack of federal resources means that Massachusetts, for instance, can only be as good as Massachusetts can be. It can't rely on the resources and the technical capacity of the US federal government, which are quite substantial. So even the best states can only be so good given that set of constraints. One other thing I want to mention kind of from a global perspective, and then I want to talk a bit about the future as I see it in the United States, and I'll wrap up. One country that we haven't talked as much about, but requires, I think, some attention, maybe we can discuss this more, is India. India is now the global hotspot, generating 80, 90,000 cases a day and continuing to go up. And I don't see much that really puts hard brakes on the outbreak in India. It has shifted away from the Mumbais and the Delhis into the Uttar Pradesh and Bihar, these large, poor, rural states where cases are really exploding. And so I'm deeply worried about what will happen to India in the weeks and months to come. All right, let me finish off by saying, as I look to the US over the next 6 to 12 months, the key issues are, I think we're going to get a vaccine approved in late October, whatever the data might be, and we can talk more about that. I think there is a rush to do that. I think there is going to be a battle about that vaccine and whether it's safe and effective. We will continue to see improvements in our biomedical response. And we will limp along with probably tens of thousands of cases and many hundreds of Americans dying every single day, probably well into the winter, until we see some substantial technological challenges, either in therapies or in improvements in the vaccine. The fundamental point is that when you think about a response to a pandemic, you have two arms of that. You have a public health response that's about social distancing, testing and tracing, mask wearing. And you have a biomedical response, therapies and vaccines. And America has largely, or large parts of America has largely given up on the public health response and is hoping for the biomedical response to bail us out. I think it eventually will, but the cost will be enormous, both financially and in terms of lives lost, and much of it is wholly preventable. So let me stop with that, and happy to have a discussion with two esteemed colleagues and Larry as our moderator.
Thanks very much, Devi, Salim, and Ashish. Really fascinating. So I want to pick up on the themes that the three of you began with, and then kind of broaden out a little bit more. You know, one of the things that I want to ask you generally has to do with, you know, why have some countries done so well and some countries have done so badly? In other words, what separates them? You know, it seems like, you know, from, you know, Devi and Ashish, that the model, you know, of kind of, you know, test, trace, isolate, lock down, but then open up smartly seems to be the one that works best. Many countries have tried that. Some have done really well, some haven't. The second point to reflect on is, she's talked about federalism, quite rightly so. Some federalist countries have done really badly. Brazil, the United States, India. Some federalist countries have done really well, like Germany. So what separates them? And then what's the world going to be like, or is a country going to be like when we get back to anywhere near normal levels of travel? And that is, for example, if the Northeast states are doing well in the United States, what's going to happen when people start flying again or traveling a lot from one state to another? Is that sustainable to have two different countries? Or internationally, if a country is doing really well and we start to open up borders, what is that going to look like? In other words, is there going to be a sustainable public health response that is effective? Or ultimately, do we just, as she says, limp along until we get, a good vaccine, some good treatments? So let's start reflecting on there. Let's start with, why have some countries done well and others have done badly? What are the lessons we've learned so far in about 8 months from the public health side?
Can I just start with one very simple answer that is surely inadequate, and my two colleagues I think will fill in much more. In my mind, the single biggest differentiator isn't did you take a testing and tracing strategy, or did you lock down, or did you wear masks? It's did you take the virus seriously, or did you not take the virus seriously?
Yeah, I agree.
And if you took the virus seriously, you had a set of options, and you created your own mix among that set. And the Japanese response looks pretty different from the New Zealand response, which looks different from the German response. But if you didn't take it seriously, then you're in a version of Brazil or parts of the United States or other places. And that to me is the big kind of intellectual differentiator.
And taking it seriously, I assume, also means following the science.
Absolutely.
So the scientific evidence might point you to several strategies. You might choose among them. Slim and Devi?
Perhaps I can chip in here. So I think it's a prerequisite that you got to acknowledge you have a problem before you can deal with a problem effectively. But I have found that among those who at least accept that they are dealing with a problem, one of the most fundamental issues is to deal with the two sort of polemic positions about whether you believe fundamentally as a society in collective good, or whether you believe in individual freedoms and the way in which that plays itself out. Because in communities that we have here, where there's a lot of belief in collectivism, there's a strong sense of what we call here Ubuntu. Ubuntu is the concept that I am because you are, that I'm fundamentally dependent on you, that we don't see that much spread. But where we're dealing with situations where people want to protect their individual freedom, they're not willing to give that up for the collective benefit, at least for this short period, we have found that to be a bigger challenge. So I want to just add that as an additional overarching issue on what Ashish was pointing out.
Yeah, it's a very good point. And Devi, you've talked a lot about the common good and what duties we owe to one another. How are you thinking about this?
I guess 3 reflections. So the first, you said, what are the factors? And I think there are some which are governments didn't have much control over population size. Countries that were smaller seem to have an easier job than those which were larger. I'm thinking of the small island countries connected to that, travel. So islands found it much easier because you could control your borders, where I think, places that are very connected found it very hard. But of course, it comes down to leadership and trust in government, and actually leadership making a clear choice. The big decisions around COVID-19 are not, in my view, scientific. They're actually moral and ethical, and about trade-offs, and what trade-offs do you have, and how much do you value human life, and how do you play it off? And I think falsely, many people thought you either hit the economy or you hit health. We're learning that the places that control the virus are doing better with their economies. And of course, country wealth plays into it. It's much easier for countries that can provide furlough packages. I'm thinking of the United Kingdom, which paid people to stay home like basic income for months. Compare that to places where lockdown put people into, complete poverty, or I think places in the States where you don't have that kind of social security net. So I guess getting to the thing, where is it going forward? Because we've been thinking about this a lot in Europe, because once you've squashed your curve, if you have constant movement of people, it's going to keep resurging. And then you have constant reimportation of cases and clusters. And it's such an infectious virus that it becomes very hard to stop clusters setting off. And so I think the only way, in the long-term way out, is we get a vaccine, hopefully that's soon. And then you have a strategy to expand it. You support that by really good treatments and every day, new ideas of how to treat patients. You get mass testing out, really rapid tests. And through this, we try to control the virus and bring it down. I mean, the really challenging thing, and I think this is where the jury is still out, is I think we'll get better at deaths, but about the long-term health issues of what happens to people who recover. Because I think the deaths, we're going to get better at saving people. We already have seen the case fatality rate just come down. And I think we will get better because doctors are getting better at treating patients. But I do wonder about these people who recover. How do we deal with this population? And I guess the other issue is about immunity. We're seeing these handful of reinfections. So are these rare events, like one-offs, or is this going to be the norm that we see more and more? How long does immunity last? Because then you might have constant circulation of this virus, and it becomes very hard to build up any kind of population immunity alongside a vaccine. Also, how long will a vaccine offer immunity for? So I think these are the big questions that make it very hard to plan. But I guess there's no easy way or simple way out of this situation. I think this is a long-term problem for the world of how to live with this virus.
Yeah, it is. I wanted to stress one of the points you made, about the kind of long-term complications of the disease, both physical and mental. Even after we brought this under control with so many tens or probably hundreds of millions of cases around the world, are we going to see long-term implications for human health and well-being? I think is really a critically important question. We haven't asked enough for the future. Now, we've only got, another 10 or 15 minutes before I want to open it up to general questions. But, there are two themes that I've heard you talk about, and there's another that I want to hear you talk about. The two themes really have to do with one, and Salim really, hit this hard, was the question of equity. It seems to me that, the prevailing narrative of our time, of our global age, even before COVID, was, the vast injustices, and Martin Luther King saying that health injustices are the worst of all injustices. And so talk a little bit at equity. And then after that, I want to talk about, drill down a little bit into vaccines, trust in regulatory approval, vaccine hesitancy, coverage to gain community immunity. And then I'm going to just end with an issue that we haven't discussed, but is terribly important and connected to the first two. So why don't we start with equity? If anybody would like to just kind of jump in and talk about, what has this taught us about justice, and what can we do about it going forward?
Perhaps I'll start just by making the point that as I have been looking at the way in which this epidemic has unfolded, it has really shone a very bright light on all the different fault lines in our society. The fault lines between race, between class, between access to healthcare. And as each fault line is being highlighted, we're getting a sense of the way in which this epidemic exacerbates those fault lines and highlights them for us. And I think it's an opportunity for us to start thinking about, dealing with these issues that we know have existed, but we've sort of swept them under the carpet because they've been uncomfortable. but I think they're becoming very obvious. And as we look to next year and the year after, in all likelihood of this virus, those fault lines are going to become the source of civil unrest. They are going to become the source of what's going to force change within our society, I think. I'll stop
You know,
there.
the civil unrest, I think the protests in the United States are now spilling over globally about Black Lives Matter. You know, it's different, but it's also, you know, I think deeply interconnected with the pandemic. You know, Devi and Ashish, you've talked a lot about equity in your thinking and your writing, and been an inspiration to us. Did you want to add anything to Slim's points about equity?
Yeah, I can start, which I think we've talked a lot about shielding through the course of this pandemic and who should shield. And what becomes clear is the best shielding strategy is to be wealthy. Because if you're wealthy, you can easily escape the virus. You don't need to work on the front lines. You don't have an essential job. You don't have a small home. And I think this is what has been really difficult at every single stage, whether it's your risk of getting COVID-19 or whether it's the knock-on effects of lockdown measures or of unemployment. It has disproportionately fell on those who are from deprived backgrounds or from groups who are marginalized. And it's purely, it's unfair. And I guess recognizing there's a problem is the first step, but then working to address it. So for example, when I hear the arguments for herd immunity or just say, let it go, my point is it's very easy to make that argument from your country home, you know, saying, you know, we got to get people back to work. How many of those people are actually putting themselves on the front line? Because the people it's going to hit, and we've already seen it in the UK and across Europe, is those who are cleaners, those who are security guards, those who work in grocery stores, those who actually have to show up and be exposed. It hits families which are multi-generational, who are all living together in a small place because they're living in close areas. It hits care home workers who are often on 0-hour contracts. And moving to lockdown measures, you know, what I think this proves true with lockdown is you had, you know, the wealthy escaping to country homes on private jets, kind of enjoying this time off. You had the middle class trying to juggle from home, you know, Zoom calls and their kids and homeschooling. And then you had the working class actually having to go out and work and having no childcare for their kids and wondering where to put their kids for most of the day. And it really exposed that as well, the different experiences of lockdown. And same with unemployment. We're seeing now vast unemployment. And again, it's hitting women disproportionately who have been let go because of flexible working arrangements they might have had. So I think it's just shining a light on all of this. And there's no easy answers, but you know, I don't see COVID as being the great equalizer. I think it's quite the opposite. I think it's actually created, and as Salim said, showed the divide, you know, the fault lines in our society, and actually what kind of society do we want going forward? And nothing reflects it as well as the issue of, they call it in the UK BAME issues, but basically Black, Asian, ethnic minority issues, groups that for some reason disproportionately are affected and die of this virus. If nothing else, this virus shows the underlying reasons why that is, or less about genetics and much more about social and economic inequalities.
Yeah, that's beautifully stated. Ashish, a few final remarks on equity before I go to vaccines.
Yeah, one line only to add, which is in the US, it's been a similar experience. And when people talk about, you know, these protests are happening in the middle of a pandemic and how these two phenomena seem to have landed at the same time, they're not unrelated at all, as you said, Larry. They're deeply connected. And I think what people are realizing is what Devi just laid out, which is systemic racism, systemic anti-Black racism in the United States has led us to a set of factors that then get stressed and exposed in this pandemic. It would in any outbreak, but then the response to the outbreak has made that much, much worse. And so these are, you know, it's easy to see these two phenomena as unrelated and my God, how could we have this at the same time? They're actually deeply intricately connected, and one has brought the other one to the forefront because it's really made the effects of longstanding systemic racism unbearable in a way that we just, I don't think we can keep hiding under the, you know, sweeping under the rug anymore.
Yeah, I hope our students and our wider audience appreciates what the three of you have said about the injustices of this pandemic. I mean, to me, this is the most important lesson, that if we don't learn it, we're going to be the poorer for it. I want to just, you know, pivot, if I may, to vaccines, but particularly vaccines, not just because they're the great hope. It's the great race for the most coveted medical commodity in our lifetimes, but much more about also what does it say about our regulatory agencies, our public health agencies. I know that the US CDC has taken a huge hit in its reputation. Now the US FDA has indicated that it might authorize, at least in an emergency use or maybe even broader, before completion of phase 3 trials. Russia, after the most preliminary, first phase trial, has approved its vaccine. Both Russia and China have used them already on military, and China on minors and others. And so that there's this kind of, the race is also putting, stress, political, social stress on our prized public health agencies and our regulatory authorities. So reflect on that, and then, what will this kind of rush with potentially cutting scientific corners and ethical corners mean in terms of increased vaccine hesitancy or a lack of coverage so we don't get community immunity? I've been part of a group that did a survey, a global survey of people who would be willing to take the vaccine once approved. And it's pretty low. It varies across countries, but it's pretty low. So, talk a little bit about, where we are with vaccines, what the future will be, and particularly how it puts stress on our regulatory agencies and how they can push back against any political pressure.
Do you want me to start since
I was thinking you would start. Thanks, Ashish.
I haven't really been holding back on this publicly. There are many casualties of this pandemic. Loss of credibility of our two most important scientific health science agencies, the CDC and the FDA, will certainly be at the top of the list or near the top of the list. And what's been amazing about both of them, and then I'll get to your question specifically, Larry, is that the great scientists of the CDC and the FDA are still there. We have not seen them leave in large numbers. Thank goodness. But how they manage, I don't know. How they manage to stay in it, I don't know. But what you've seen is, and I've talked to a lot of people who've worked in the White House, in the Bush administration and the Obama administration. There's always a very strong pull to say what the president wants. It makes you feel good to be in the White House and to please the president. And the best presidents, and this has happened, and this has been bipartisan, have tried to create an environment where people can give them bad news, because it's very dangerous to be in a place where you can't get bad news. And not this president. And what he has done through his pressure is taken two people who I think have not had the ability to withstand that pressure, Steve Hahn and Robert Redfield. And both of them have really compromised their agencies in a way that will harm us for a long time. So there is going to be, no matter what happens in the next election, there's going to have to be a rebuilding of that trust. But to your question, and I'll just answer it this way, at this point, I don't think a majority of Americans trust a result from the FDA as the gold seal of approval. That's a shocking statement to make. 6 months ago, I would have never believed myself making that statement. But I think that's where we are today. And so people are going to have to find alternative ways of coming up with feeling confident about a vaccine. And that's going to have all sorts of negative detrimental effects on vaccine hesitancy around our country.
Do either Salim or Devi, do you want to jump in here on vaccines? So certainly Oxford's
Sure.
got a good candidate, Devi. How do you think about these things?
Well, I'd say from watching what's happening in the States from across the pond, it is quite shocking, because I think, yes, the British government has made their share of mistakes, but one of the things I think they've been very good on is, well, aside from supporting WHO and trying to be a good global player, is also not trying to interfere with the science. they're absolutely delighted if some of the science they fund for clinical trials turn out to have good news, and they will of course brand it as British science, but they are not interfering with the trials. They are not trying to, at least externally, it doesn't seem like there's undue pressure. They want the trials to happen. They want it to be done properly, and they want the scientific process to be clear of political pressure. And I think that has been valuable to see, because if you look at recent surveys, it just showed the British population are more likely to take a vaccine. And the survey showed, and I think it's because of that, and that separation of trusting that the process will take place and the results will be respected. I think very worrying as well is this vaccine nationalism of the race for who has it first. So Russia was first, and then China, and then now Trump trying to do something before the election because he feels the election pressure. And this is incredibly dangerous, because if there, God forbid, is some kind of backlash in terms of there's an adverse reaction or there's a side effect or it doesn't work, this is going to scare the entire world off a vaccine, because for many people, they may not differentiate between the various vaccine trials. They just see it as a COVID vaccine. So I do worry about actually also the negative repercussions for vaccine hesitancy as a whole through rushed processes as a whole. And so I guess that from watching afar has been, and as Ashish said, I would never have thought the CDC and FDA would be in the positions they're in. And this just shows again that as much as scientists try to stay away from the political process and to stay focused on science, how much it's absolutely linked to politics. And you can't really get away from that. So I'll end there.
Slim, did you want to jump in here? I'm going to go on to.
I'll just briefly just add to the very good points that both Devi and Ashish have made, to say that societies depend on the integrity of their institutions, and dictators and corrupt leaders, whether they are financially corrupt or intellectually corrupt, their aim is to undermine those institutions, because those institutions are a challenge to their authority. And when you undermine these institutions, it's all very well to do so for your own particular needs at the time, but it takes a long time to rebuild institutions that have been broken. We've seen that in my own country. Our previous president was totally corrupt, and he, really gutted the prosecuting office. He gutted the police services that would look at priority crimes. And now we're having a challenge to really rebuild those institutions. And I think we're going to see that not just with the FDA and the CDC, but there are many institutions across the world that are being compromised. And I worry that the rebuilding is going to take a long time. And in regard to a vaccine, even if a vaccine has a serious side effect, that's say 1 in 10,000 or 1 in 1,000, when you're going to vaccinate billions of people, dish out billions of doses, that's going to be a lot of side effects. And so we want to be quite confident that our regulatory authorities will do their job without fear or favor. And thankfully, we have a WHO that has a lot of that capability, and we can count on to a large extent. But when you see what's going on in the US, it really bodes ill for what's to come in the near future as vaccine trial results become available. I'll stop there.
Yeah, well, you've actually given me a great transition. Thank you, Slim, because we've talked about domestic regulatory and public health agencies, and absolutely appropriate that we should focus on that. But we've also seen international institutions that have been compromised as well. One could argue, for example, that the World Health Organization has been caught in the middle of a geopolitical struggle between the United States and China, the two great superpowers of the world. So I wanted to talk a little bit about, what are the state of the international institutions and global cooperation, something that Devi's worked on quite substantially, for example, in relation to WHO, and then COVAX, the WHO partnered a facility that's trying to coordinate international trials for a vaccine, and then equitably distribute them. So let me start by this. We've got, if we put together the issue of vaccines and equity, one obvious thing is that most of the better clinical trials that are going forward are 2-dose trials. So we're literally talking about billions upon billions of doses globally, and the logistical nightmares, as Ashish had said, getting these vaccines to people in clinics, in their homes, in their communities, particularly poor communities around the world. And then to do so equitably with, I'm paraphrasing from a lot of the questions that we've been getting, and I've been monitoring them. We've got populist nationalist governments that, the whole idea of, vaccine nationalism has been brought to bear. Hoarding the United States and other countries have pre-contracted with pharmaceutical companies to buy up doses of the vaccine. So talk about, equity vaccines, but relate it to the World Health Organization, COVAX, global solidarity, the importance, of, we're all in this together, but are we together? Devi, did you want to start? Because I know this is really right in your wheelhouse.
Yeah, no, I was just reflecting on your question. It's a massive one. I mean, I think going back to WHO, the way to understand the agencies, they want to be everybody's friend and they want everyone to get on. And so right now when China and the US and Russia are doing their politics, they don't want to really be part of it. They're kind of like, these are all like, their parents, divorced parents fighting, and WHO is the child just like, I want to be friends with all of you. Don't make me choose sides. And I think if you see WHO through that lens, you can start to understand their positioning, their press conferences, their management, where they keep trying to bring everyone to the table and keep trying to get member states, which they did successfully at the last virtual World Health Assembly, to commit to global public goods and committing to sharing of these, which the US did commit to back in May, but seems to have now decided it does no longer wants to actually participate in COVAX. And I think looking forward at the nationalism, it's a really tricky one, because if anything, this crisis had made countries look inward, because one of the best ways to protect yourself, coming back to islands, has been border measures. And same for many sub-Saharan African countries, which have seen actually use their borders as a protective measure. Actually, I think it was Mali closed its borders before it had any cases, because they knew if they got too many in, they wouldn't be able to manage. You've also seen stresses on supply chains. So the problem of getting PPE, I think there was a question about PPE and the US trying to stop 3M from fulfilling contracts for N95 masks for Canada, and ventilators being stolen from Barbados and all this stuff. And I think a lot of countries are rethinking of how can they move their supply chains in-house, and so they don't rely on other parts of the world. So it is this very particular moment in the world where we're all interconnected more than ever. It very much matters what's happening in the world. This all started in a cluster of small cases in Wuhan. I still remember January 2nd seeing that memo of a pneumonia-like cluster. At the same time, it's revealed how much countries turn inward to try to protect their citizens and can act in very, what could be seen as selfish ways and unenlightened ways about our connections and connectivity. So it remains to be seen how the world moves forward from this. I think there has been a large absence of global leadership from the United States. I think it is very much felt, because this would be the moment for the United States to come forward and show kind of liberal internationalism, and that kind of strong weight of the United States history of playing that kind of role in global health. And I think the complete absence of that has created a bit of a vacuum currently. And this has just resulted in every country kind of trying to find its own way through without having some kind of cohesive force to try to bring everybody along. So I'll stop there, yeah.
Well, thank you. That's really very helpful, Devi. I mean, we've only got 5 minutes left. Perhaps I'll just invite Ashish and Salim to kind of give final remarks, then I'll sum up, and then we'll transition from this public meeting to our class once again. And I'll say thanks in advance before we do that. But Salim, do you want to go first, and then Ashish? And then I'll sum up and just look at some of the lessons that you've taught us.
I've been struck actually by this whole notion that there are countries that believe that they should be first, and they should use their financial clout or their political clout to secure vaccines at the expense of others. This kind of vaccine nationalism that we are seeing is based on a very fundamentally flawed premise that, I can be safe when you are not safe. That's just the way in which this virus works. It's a pandemic because it spreads globally, and nobody is safe until everybody is safe. And that notion that you can create, your own little fiefdoms of safety is being shown up. I mean, island nations, as Devi pointed out, have done exceptionally well. Fiji, Mauritius, New Zealand, and so on. But even they, can't be protected forever. And so we all have to find some way to make this very fundamental point that our futures are fundamentally intertwined in this epidemic. Thanks.
Thank you for those wise words, Slim. Ashish, do you want to finish off, and then I'll just wrap up a little bit?
Yeah, I worry about finishing on what might be a bit of a sour note, but hopefully there is an action underneath it. I think the future of global solidarity, of international cooperation, of multilateral institutions is going to come down to tens of thousands of votes in 3 or 4 states in the United States on November 3rd. I think if Donald Trump is reelected, which I think is an entirely possible, maybe 50-50 at this point, possibility, we can have all the Zoom calls and talk about international solidarity and the belief in multilateral organizations. The world will see what is very clear, which is a guy who ran for 4 years against all of this, who governed for 4 years against all of it, and then was reelected. And I think we've seen the effects of Trumpism, not just in the United States, but in many other countries. And I think it will accelerate that trend. And I think we are looking at a generation of real challenges in building back global solidarity. Let me flip that. If we do our job right on November 3rd, and I don't want to turn this into overtly political, but I'll be honest, and make sure that America votes out that kind of nationalism, then I think the opportunities for rebuilding global solidarity and reinvesting in international cooperation is endless. I think it's quite solid. And we could, while we've had a horrible first year of the pandemic, 2021 could be the year that we are far more aligned together as a global community with American leadership. And it will largely come down to 3 or 4 states and a handful of voters. And that, to me, is the biggest tragedy of this, because the repercussions of those votes and of our election are going to be felt by people around the world, most of whom have had no input whatsoever into what happens on November 3rd. So I don't want to make this a deeply American political conversation, but I do think it will have profound effects for a generation, depending on what happens on that night.
Well, thank you, all 3 of you. We haven't had a lot of optimism in our discussion. We've talked a lot about, the idea of populism and nationalism and splintering apart and inequities and injustices and wide variability in competency and ability, the undermining of science and scientific agencies. But if I were going to be optimistic, and I think there are reasons for it. I mean, we are engaged. If you step back and you look at just the sheer awesomeness of Mother Nature with a tiny microscopic pathogen that jumps species somewhere in Wuhan, probably in a wet market, and then encircled the world within months. But we've also, in an epic battle, science and public health, we know more now than we've ever known, and we will get out of this. And I think Ashish's timetable of sometime next summer sounds about right to me, that we will get out of it. And then when we do get out of it, we do have choices as a global community. And I do hope we see that the choice is one for really focusing on equity and justice, focusing on global cooperation, realizing that science was the one that saved us, and that science and scientific agencies and international institutions through COVAX and WHO and other mechanisms, the Gavi Alliance, are really, after all, quite invaluable. If we have that lesson, and perhaps, yes, if Ashish is right, if we have a globalist in the office, like Joe Biden, and Biden has said that on day one he would reverse the withdrawal from WHO, we might well see, a sun rising in the horizon. There's a lot to go. Devi began by really, talking about the fact that, this pandemic is in front of us. It's not behind us, but it will be behind us soon. And I hope that we will all work together. I know we will on the panel, and I know the O'Neill Institute will, and all of our respective institutions will, and the audience, to try to kind of work for a better prepared, more equitable world. Wouldn't that be a lovely epitaph for the future of this world? But we're still in it, and we just don't know. So thank you very much. Just a superb conversation. I was mesmerized by the three of you and your wise words, and I just want to take this opportunity to give you my heartfelt thanks for what you've done. We're now going to end this public session. We're going to take a 3 or 4 minute break, and then Jeff Crowley and I will come back with our class. We talk about the future of the class and also a little bit about what we learned today. So thanks again to you, and thanks for our whole audience. Take care, everyone. Be safe.
Bye-bye.